Good morning. Good morning and good afternoon from Spanugo. Today's webinar is titled Healthcare Cybersecurity Best Practices for 2020. And the presenter is Anupam Sahai, that's me. So a little bit about my background. I've been involved in cybersecurity, GRC, risk management for the last 15 plus years. I've worked in a combination of startups, product companies, and large companies in the areas of product management, product strategy, and go-to-market. And in terms of my education, I went to IIT Kharagpur and then MIT for my master's in engineering and management. So let's get on with the agenda plan for today. The agenda today is the following. We want to first look at healthcare as a vertical and understand why is it the top target for cyber attackers. We will also look at some of the key learnings from 2019 around the healthcare breaches. What were the key threats there that affected and caused the breaches? And then we'll turn into the learnings from that and how to turn it around and make recommendations on best practices that we as an industry, healthcare industry, can adopt to deal with such threats. And HIPAA compliance, while it's a great start, needs to be augmented with a number of key capabilities, which will also lead to increased cyber protection. And then we'll talk about cybersecurity assurance, how to automate both the HIPAA compliance and the cybersecurity protection issues through an automated tool, which is what Spanugo does as well. And then at the end, we will have Q&A, and I would encourage you to type your questions as the session is progressing. Please type your questions in the Q&A section, and we will pick it up at the end of the webinar. So let's get started. So if you look at the healthcare data breaches, or in this particular case, overall data breaches that are happening, the cost of a breach is very expensive. You're talking about $8.2 million average cost in the US for an average, for a cost of a data breach. And healthcare happens to be the most targeted vertical because the value, the cost of a healthcare record in the underground market is the highest. It's about $450 in the underground market. And an average size of a data breach is about 26,000 records. So you can imagine the value that attackers derive from breaching healthcare information. And the other thing to note here is that an average time to identify and contain a breach is about 280 days, which is roughly about 10 months. And that's a huge time. And it gives the cyber attackers a huge advantage, an asymmetrical advantage to steal the data and misuse it before the attack or the victim company is able to find out. So prevention is better than cure. By the time you know about this data has already been sold and misused. The other reason why healthcare organizations need to be doubly or triply careful is because of what I call the triple whammy effect. And that's because not only you lose the critical data, government may fine you because of losing the data. And then, of course, the patient lawsuits, in case you lose patient information, patient healthcare information, is another side effect of all these breaches. Now, talking specifically about healthcare data breaches, and by the way, this data is still hot out of the press from the 2019 perspective. There was about a 50% increase year over year between 2018 and 2019 in terms of the number of data breaches that affected 500 or more records. And you can see here that the number of records lost was about 41 million. If you leave aside this blip in 2015, which was really a very, very negative year from a breaching perspective, and in 2015, if you recall, Anthem got breached, Primera Blue Cross got breached, XLS Health Plan got breached. Anthem, we lost about 80 million records. Primera was about 11 million. So it was an anomaly which resulted in 113 million records that were lost. But otherwise it's been a pretty bad year just looking at healthcare alone. About 41 million records. It tripled from 2018 to 2019. And here are some of the fines and settlements that of the OCR, which is the Office of Civil Rights, negotiated or fined the different healthcare entities. And all of this data is derived from public information released by Office of Civil Rights or Health and Human Services. So let's do a brief recap of what is that we are trying to do. And most of you probably already know this, but we are essentially trying to protect PHI, which is patient or protected health information, which includes not just the health information, but also personal information like name, address, birth date, and social security number. So it's a fairly broad set of very important and critical information that needs to be protected. And if you look at HIPAA high-tech, which is really the government regulation that is entrusted with protecting and dealing with how to protect PHI information, these are the 4 categories of controls or protection mechanisms that are specified by HIPAA high-tech. There are categories of administrative procedures, which is really focused around governance and policies and procedures. The second category is around physical safeguards, which deals with physical security issues and how to provide and protect your critical information. And then number 3 and number 4 are focused around technical security services and mechanisms. And that's really the focus of our conversation today. Excuse me. But the technical controls, which are the IT asset-related technical controls, they take about 80% of the overall HIPAA compliance and security, information security, cyber attack, cyber breach any cyber breach program, whether it's HIPAA compliance or any other control framework like ISO. The IT controls take about 80% of the time, and it's very complex, it's very time consuming, and it's very fast changing. And that's really the subject of the discussion today. So let's jump right into what are the key learnings from 2019. I talked about the data. It doesn't look very good in terms of number of breaches climbing, number of records lost, but why did it happen? And so we looked at all the breach data, all the Office of Civil Rights breach reportings, and here is what we find. So one of the key things that we find, organizations that get breached have not performed a security risk analysis. And this is one of the key tenets of meeting HIPAA requirements. And so this is something that we find across the board. Ransomware and phishing attacks cause about 20% of all the breaches and attacks that have happened. And that's, again, a huge challenge. Cloud security hygiene, this is another big area. As companies are moving to the cloud, ensuring that you have the proper cloud security hygiene methods and mechanisms and prevention techniques deployed is very key. And a number of attacks or number of breaches that have happened is to deal with data sitting in the cloud, which has been inadvertently shared with an external person, and it was shared publicly by mistake. Unauthorized access, and this is related to misuse of credentials. Either the credentials were misused internally, or they were stolen, or the access control policies are not properly designed, and hence there's a problem and misuse because of that. Dealing with system misconfigurations and vulnerabilities. This is a huge challenge, and it's been estimated by Gartner that system misconfigurations and unauthorized access and role access related issues cause about 80% of all the breaches that happen. 80%, it's a huge number. And so making sure that your doors and windows are locked in your house is the first step. And dealing with system misconfiguration, vulnerabilities, unauthorized access is very important. Failing to encrypt. Encryption is not a mandated requirement for HIPAA, but the advice, generally the advice is that it should be encrypted wherever you store it, whether it's stored on your premises, in the cloud, or it's being transmitted, shared with somebody else, it needs to be encrypted. And being able to store data in servers that are publicly accessible, that's, believe it or not, that's happened for a very few but large number of breaches that have happened. The next particular threat is around vendors and business associates. And since the covered entity is responsible and has a shared liability to protect the data, and once that information is shared with third-party vendors or business associates, they also need to protect the information, need to have information security safeguards to protect the data. And a number of the breaches that have happened because the business associate or the vendor did not take safeguards to protect the information. 60-day deadline for issuing breach notifications. Again, this is a requirement from HIPAA that there is a need to notify either the upstream entity, if the data gets breached in a business associate or a vendor, they need to notify the covered entity, and the covered entity needs to notify the government if the number of records breached are more than 500. So this is again process related that needs to be followed. Otherwise, there are heavy fines, and you might get audited if they realize there's a lot of negligence that's happening. And finally, the disposal of ePHI, making sure that you destroy the electronic records of patients or protected information that is no longer in use is very important. And this is based on, as I said, the healthcare breaches and OCR fines. So what can we do about it? So one of the biggest challenges is to first start with the basics. There is a need to do a HIPAA security risk analysis. That's the bottom line. If you don't do a security risk analysis, you will not know where you stand today with respect to not just HIPAA compliance requirements, but also with respect to putting together cybersecurity safeguards against attackers. Doing the gap analysis to know what's your desired posture versus where you are, and then fixing the open issues or the gaps that are found to meet the desired goals, the desired HIPAA compliance posture or a cyber security posture is very key. Second thing is to identify all the critical assets that you have in the organization. And critical assets could be assets that are dealing with protected health information, or it could be any critical data. It could relate to your financial information. It could relate to anything that you would like to protect. Understanding where they are, how are they stored, who accesses them is very key. Third is focus on the cloud security hygiene. And the shared responsibility model needs to be understood. It's been a source of great confusion because the line blurs if you're not careful between what the cloud provider is responsible for and what the end customer is responsible for. And to make matters worse, depending on the type of service that you're getting from the cloud provider, whether you're buying infrastructure, you're subscribing to infrastructure as a service, or platform as a service, or a SaaS offering, the boundary or the line between what the customer is responsible for and what the cloud provider is responsible for needs to be understood. And as a customer of a cloud service provider, you are responsible for the end-to-end security of your applications, of your virtual machines and physical machines. Dealing with misconfigurations and vulnerabilities. Once you do a gap analysis, you will know what are the open issues with respect to misconfigurations and vulnerabilities, and you need to take steps to address it. Encrypting everything. This is, as I said earlier, is very important. No matter where the data is, whether it's stored on your premises, in the cloud, it needs to be encrypted so that even if hackers get in, they're able to access the data, they will not be able to make sense out of it or misuse it. Next step is to ensure that your access control policies are watertight, that you have, not everybody should be a root user, or root users should not have permissions to do anything and everything. You need to be able to create a role-based access control policy and give access as needed, depending on the privacy and security laws, to the appropriate people. So there are a number of things you can do from a access control policy perspective, from sharing the information perspective. And then there are other things around putting together an incident response plan, make sure that your employees are trained, and that your supply chain, which includes vendors and business associates, are secure, that they have taken steps to be HIPAA compliant, to protect the PHI information that you're sharing. And from a limiting of the liability perspective, you need to make sure that you have vendor agreements or business associate agreements with them to ensure that they don't, if they do get breached, that your liability is limited, et cetera, et cetera. And finally, ensuring that there is a proper disposal of ePHI information. And again, as if you had a customer that decided to go to another provider, you need to make sure that the information is destroyed, and whether it's physical, paper-related information or electronic information that's destroyed, and there is a process recommendation there that you should be aware of. So if you look at this, the top 6 are the IT controls. They relate to IT infrastructure. That's typically a convenient entry point, because now everything is on the internet, everything is interconnected, that the internet becomes a key entry point for hackers and attackers. And that's why the need to focus on ensuring your IT infrastructure is indeed locked down, secure, and compliant. And this is where the time-consuming part is, because cloud and on-premise infrastructure can change very rapidly, and there is a need to ensure that you're staying on top of any changes. And at any point in time, there should not be a point in time where your defenses are lowered because attackers are going to come in. And remember that 279-day asymmetric deadline, where it takes about, on an average, it takes about 279 days to understand that you got breached. And that 9-month period is enough for hackers to come in, steal the data, sell your data. So it's a very high risk and low asymmetric battle. And that's why prevention is better than cure. You want to make sure that you are able to protect your infrastructure proactively. So given all of that, the question is, what can we do? It's the infrastructure is getting complicated. 90% of enterprises today have a combination of on-premises and cloud environments. Some of them have multi-cloud environments. And you want to make sure that we have access to and knowledge about and visibility about all the IT assets that are being used in the company, and then be able to protect it. And that's where a tool like Spanugo, which is designed for a hybrid cloud environment, which will take care of discovering your assets on your on-premises and in multi-cloud environments, and we will give you a single unified posture that tells you where do you stand with respect to your overall HIPAA and cybersecurity needs. The solution automates checks for configuration and security best practices. So you can decide what control frameworks are relevant for you. You can say, I want to be HIPAA compliant, and I also want to follow NIST guidelines. And by the way, I also want to do PCI because I'm taking payments from customers. So you can pick and choose whatever frameworks are relevant, pertinent, and that becomes a baseline. And then Spanugo goes to work. It does discovery of all the IT assets, benchmarks your current security and compliance posture with respect to that baseline, and comes up with a prioritized gap report that tells you exactly what you need to do, how to fix it, and then maintain your posture. So there is a continuous audit assurance to make sure that your cyber defense guards are not lowered, which would in turn give access to the cyber attackers to come in and breach your infrastructure. And this is all offered through a SaaS solution. So there is nothing to install or deploy for every asset in your company. You subscribe to the service, and it does its own magic, as it were, to tell you exactly where you stand. This is a little bit more detail into how it works. I won't spend a lot of time on this today, but basically, just so that you know, there are multiple stages of the product. It does discovery of assets. It assesses your current compliance and security posture based on your baseline requirements. As I said, you can pick HIPAA, NIST, ISO, CIS, any combination of frameworks that you would like to comply with or be secure with. Then we will come up, it will discover and tell you your posture, give you remediation guidance, which tells you how to fix it. There's integration with Jira and ServiceNow so that you can assign these open items to your IT team or SecOps team or DevSecOps team to fix it. And then it goes into a monitoring mode to ensure that you are able to continuously monitor how the posture is, if there are any actions that need to be taken. So if we go back to the best practices, I had outlined 10 best practices, and out of the 10, there are about 6 of them that are IT control related. And as I had mentioned, the IT controls part take about 80% of the time, whether you're trying to be HIPAA compliant or whether you're trying to just protect your infrastructure against cyber attackers. It takes 80% roughly of the time, depending on your scale and scope of what you're trying to do. And so being able to automate that by dealing with your complex infrastructure, as I said, 90% of the enterprises today have a combination of on-premises and multi-cloud environments, and giving you visibility, ensuring security and compliance of your infrastructure is a huge challenge. And that's where Spanugo is able to come in and able to give you that visibility and that continuous audit assurance to ensure that you're HIPAA compliant and that your cybersecurity posture is not compromised. This is a little bit of a flavor in terms of what Spanugo does. So what Spanugo is doing is it's looking at all the HIPAA control requirements. And as you would know, the HIPAA authority document has all these guidelines with respect to how things should be accessed, who can access it, and protection related to protection and privacy and security of the PHI information. And what what we have done at Spanugo is to take those requirements and map it to specific IT controls that are relevant, that can be automated, and we map them to the infrastructure requirements. So in this case, for example, you have a HIPAA control which talks about encryption and decryption, and we've taken that and mapped it to the IT assets. If you have assets sitting in the cloud or on a server machine or databases or multi-cloud environments, we are automatically able to take that requirement specification from HIPAA or any other framework like NIST, and we are mapping it to the different IT assets that you have that are discovered by Spanugo, so that you don't need to worry about the complexity of different type of assets that are there. We will discover them, we'll apply the appropriate policies and the relevant checks to ensure that you get the right information about your current posture, and then you are able to use Spanugo to fix any issues that are found. So this is what the dashboard of Spanugo looks like. Once the discovery has been done, you'll get a complete dashboard view, but also an operational view of what's working, what's not working, how to fix it, and get back to your desired security and compliance posture. So this is showing you a trend line of red, green, yellow. Red is bad, green is good, and it tells you, gives you a bird's eye view, but you can then drill down and kind of look at what's going on. So there's a time series of checks that you can see here. You can go back and forth. I'm just showing a screenshot, but in the product, you can go back and forth to look at a particular timeline and understand your posture. And in this case, it's telling you your HIPAA posture for the AWS infrastructure is all red, and the number of critical issues. And we also tell you the security score and the compliance score, which is really an assessment of the relative importance of all the issues that were found and how important is it towards your HIPAA compliance posture. You may have one policy that fails, but if that's the most critical policy, then your posture is deemed to be very poor. If you have stored, let's say, PHI information on an S3 bucket or on a server that's publicly accessible, that's a disaster waiting to happen. And so the score will be affected much more than if you have a not so severe policy failure, and thereby you're able to see that in the security scorecard and the compliance scorecard. So it's very aware of the different requirements, different IT assets, and gives you a holistic, a realistic picture of the entire infrastructure. This is another perspective where we also tell you if things are changing. And this is very critical because you might be secure and compliant at a point in time, but things change literally every minute. And being able to detect drifts is achieved through a continuous monitoring capability. And you can see whether certain assets got flipped or the posture changed. The blue dots indicate that something changed. And so you can drill down, go in and do a forensic analysis to figure out what happened there. And you can do that over all the time points or the time series or the checks that were done in different points in time, and you can do that. There are lots of reports available which essentially tell you and document what your current posture is, or you can use that to assign a team member to work on certain issues. So here, for example, this is a report which tells you your overall posture. And you can see here that a lot of things failed, the 7 critical controls that failed, and a number of them were critical, some were high severity. And then you can see detailed information around what happened for every control. So you can see here there were 512 assets, 111 of the assets passed for this particular control requirement, 74 failed, and unable meaning that either they were not discovered or they they're not relevant to to the HIPAA assessment. So you have a snapshot literally at your fingertips to understand, given all of your assets, which controls passed or failed for that, and then you're able to take remedial action. This is again giving you a little bit more next level mapping of one particular control. So if you go back here, 164.312A1, which was a single control, has been mapped to these many policies. And there are about 110 checks that were done to meet that requirement. And there are about 512 resources that were assessed dynamically in real time to come up with this scorecard, which tells you which one passed or failed. So we don't give you the information. If you just want to look at a top level view and then have somebody in the team understand in more detail what needs to be fixed. We also have the auto remediation capabilities, which allows you to press a button and fix those issues. Some of the issues may require manual intervention. It's really up to you how you want to fix the issues. You can create tickets around it so that you're able to deal with them. Now, I would encourage all of you to take the free test. If you go to our website, this URL, spanugo.com, we have a detailed test that you can take. It takes maybe 5 to 10 minutes to get a good understanding of what you are doing and how you could improve. This is free, and you're able to go to this URL and take the test, and we'll send you a detailed report with recommendations on excuse me, how to improve your posture as well, so that you know. So in closing, what I would say is the following. As I mentioned, healthcare is a primary target for cyber attackers. And that's because the value of the medical record is the highest. And also because it takes 9 months to detect whether you got breached. So you can't afford to, before you know it, you might lose the data if you're not careful. So understanding where you stand from a security risk analysis perspective is very important, and that establishes a baseline. And then you can use an automation tool similar to Spanugo to harden your organization, harden your IT assets, ensure that you're HIPAA compliant, and also you can pick and choose from PCI, NIST. There are about 35 such frameworks you can pick and choose from. And then you need to implement a security and compliance program that does continuous audit assurance, continuous monitoring, continuous remediation, so that you're able to not only understand where you stand today, but continuously maintain your security and compliance posture. And as I said, Spanugo is an automation tool that's unique in the sense that it can handle the entire hybrid cloud. Typically, you find tools that just do the on-premises infrastructure or just the cloud infrastructure. Spanugo is unique in that you need to have one tool, Spanugo, to deal with both your on-premises and multi-cloud environments, and it will do all the visibility, all the security and compliance posture assessment and management for you. So with that, let me pause here and see whether there are any questions. Please type in your questions in the Q&A section, and I'll give you a minute or so to ask any questions. So there's a question around, will the archived copies of this webcast and slides be available? Yes, it will be available. And to every attendee and registrant, we will send out a webinar recording, and we can include the slides too on request. Any other questions? Okay, so the next question is, why is HIPAA security analysis needed, risk analysis needed? So let me reiterate, the HIPAA security risk analysis is really a starting point. It's mandated by HIPAA, but it's also a starting point to understand your current posture. And what I mean by that is that whether you're secure, whether you're compliant, what are the gaps that are there, and how to fix them security risk analysis is really an assessment of your current posture, and that's how that will lead you to other findings, other discoveries that need to be addressed. Okay. So another question is, who's your competition? Are you stronger in one geographical area over another? Our competition, as I said, are solutions that provide a piecemeal approach to solving this. So there are solution providers that just do on-premises. So like, for example, Qualys, Tenable, Rapid7, they focus on on-prem, they focus on vulnerability management. Then you have a cloud-only solution providers, such as Redlock and Dome9, who are focused on cloud security posture management, CSPM as they're called. We are the only unique solution provider that gives you the complete end-to-end view for a hybrid cloud environment, which includes on-premises, which includes multi-cloud environments, includes cloud instances, etc. So that's really the key difference. And my contact information is right here. You can see it here. So feel free to reach out if you have any other questions. Or and with respect to the other question about geographies, so we are primarily focused in North America today from a go-to-market perspective, although we have partners that sell worldwide. So if there is an interest in outside of North America, do let us know, and we can see how we can work with you. Any other questions? Okay, very good. So I would like to thank you all for attending the webinar today. Hope you have a great day. Thank you for joining, and have a great day, and look forward to seeing you in the next few webinars. Bye for now.